होल आइडिया ऑफ टेकिंग अ सेकेंड ओपिनियन, तो एक बार तो हमेशा किसी को ऐसा लगता है कि अरे मेरा डायग्नोसिस हो गया है, मेरे डॉक्टर ने मुझे ये कहा है, मुझे उन पर पूरा बिलीफ भी है, लेकिन फिर भी मैं एक सेकेंड ओपिनियन ले लूँ क्या? तो इसके पहले कि हम इसके बारे में बहुत सारी बातें करें, आई वॉन्ट यू टू इंट्रोड्यूस योर सेल्फ.
So, good morning everyone. I'm Dr. Amit Nagpal. I'm an intensivist. I've been working in the field of critical care for last 7 years. And basically I manage difficult cases in the ICU. And that's where I specialize in. So, thank you for giving me this opportunity, ma'am, to be part of this.
Alright, so coming back to our topic, कि क्यों किसी भी पर्सन को अगर कोई भी, या तो वो खुद हो या उनकी फैमिली में कोई हो और कोई डिजीज़ हो या कोई प्रॉब्लम निकले, तो आपको क्यों लगता है कि सेकेंड ओपिनियन लेना चाहिए या नहीं लेना चाहिए? जो कुछ भी आपका जैसा भी अंडरस्टैंडिंग है.
So ma'am, second opinion it's a very interesting topic, and lot of things have changed in last few decades, I believe. There was this time back in the days when a doctor might get offended if
Correct.
you know, but this is probably there in India and probably patients across Indian subcontinent. I won't say everywhere. So they might get offended. But now I feel people are getting more educated about it, and this is a patient's right. They have a right to take second opinion.
Correct.
And as a doctor, I'll talk about myself. As a doctor, we should not get offended about it, because sometimes they want another assurance from another source. So we should be open about it, and we should definitely help them to get a second opinion. So in fact, that improves our relationship with our patients. So this is very important, especially in cases where the diagnosis is not, the disease is very severe, and they just want to have some assurance from another doctor. So for example, cases like cancers and orthopedics. So these are few areas, especially surgical branches, where patients wants to get advice from somebody else, or another doctor to go for the surgery. So that's what I.
So as you said that serious illnesses, I would say that probably you can take for simple illnesses also, because there is no harm. And आजकल तो इतना डिजिटल प्लेटफॉर्म अवेलेबल है, अब वो सेकेंड ओपिनियन करने के लिए कहीं और मतलब इवन इफ यू आर इन अ रूरल एरिया और आपको एक सेकेंड ओपिनियन चाहिए, तो भी आजकल ऑनलाइन कंसल्टेशंस अवेलेबल हैं. यू कैन सेंड योर रिपोर्ट्स थ्रू ईमेल. तो इट इज़ लाइक एम्पावरिंग द पेशेंट रादर देन एक्चुअली फीलिंग ऑफेंडेड कि अरे मैंने जो डायग्नोसिस किया था उसके बारे में आप सेकेंड ओपिनियन कैसे ले सकते हो. तो मुझे लगता है कि स्पेशली पीडियाट्रिक केसेस हैं या जहाँ पे भी, wherever you want to be reassured, it could be simple appendectomy also. Why not take a second opinion if you feel that you require one?
So there are no fixed diseases. Usually, I was just saying that this is the trend.
Correct.
But patients could just maybe, like if they feel like they're not sure about the diagnosis and they want to take second opinion, it's their right, and they can definitely go for it. And you rightly mentioned, and nowadays there are a lot of companies coming up, and there are a lot of apps. So you don't really have to visit the doctor. You can just share all the reports, and they can just give you a quick opinion.
Okay.
And this way it builds up confidence between patient and doctor, and they are also assured that the doctor is doing the right thing. And it's not just second opinion. The patients can take third, fourth, fifth, sixth opinion also.
Sometimes it confuses them, na then?
It can. But then if it is confused, that really happens. That happens when the diagnosis is only confusing. So usually nowadays, since India is producing amazing amount of doctors, plus all the doctors are quite updated, so very rarely this confusion appears.
Okay.
So usually,
and if at all it is appearing, that means your case itself is pretty complicated, and it's absolutely worth taking those many opinions.
Absolutely.
एक बार मुझे कभी ऐसे लगता है ना, when I sit in the consulting room, कि एक कनेक्ट हो जाता है पेशेंट का डॉक्टर के साथ. शायद फर्स्ट या सेकेंड ओपिनियन, दैट इज इमटेरियल, बट समटाइम्स यू शुड नेवर गेट ऑफेंडेड कि अरे मैंने कुछ कहा था तो ऐसे सेकेंड ओपिनियन. एंड समटाइम्स यू कैन नॉट कनेक्ट विद द पेशेंट. यू नो कि मैं कितना भी कन्विंस करूँ या मैं कुछ भी बोलूँ, द पेशेंट इज नॉट गेटिंग कनेक्टेड. सो इट हैपन्स बायलैटरली. तो ये एक तरह से क्वेश्चन दोनों के लिए है कि अगर आपको मेरे पर 100% बिलीफ नहीं है तो इट्स बेटर दैट यू टेक अ सेकंड ओपिनियन. तो इट्स लाइक अ सेफ्टी फॉर मी आल्सो.
And for doctors, it's not like the patient is going to your colleague or somebody else.
Right.
going to some other hospital. No, it basically helps them to understand the whole process. And I feel if you're genuine in your service and you're doing your job properly, you will not lose your patient.
100%. And more than that, there has to be a kind of, the patient should, when the patient walks back after second opinion to you,
they're more confident.
They are also more confident. You also feel, okay, everything is like pretty nice and sorted. And there are a lot of websites which are available, which are non-biased kind of websites where they can actually go and...
But ma'am, again, online source is very difficult. Cause
could be dicey.
It can, because ma'am, we don't have certified websites in India.
Right.
There are few outside India, but then you have this whole information available on the internet, and it's very difficult to filter those. Like, there's a phrase in our field, we say that this patient is a Google patient. We kind of leave it because they go through
वो
those.
तो बड़ा difficult है.
हाँ, वो
मुझे ऐसे लगता है कि अगर मैं being a doctor, if I start googling anything which I want, I never get right answers. Being a doctor, from the web, I can never find out my right answer till I go to a paid website or a proper journal or a proper. So imagine the kind of knowledge which general population is getting out of Google. Sometimes I tell the patients कि it's like मैंने Google पे देखा और मैंने एक ब्रिज बना दिया, वो कितने दिन चलेगा राम जाने. So it's similar, ना? Like you cannot become an engineer looking at a Google, and so it's the similar thing.
Exactly. So if they say that they have looked over internet and the sources are fine, you can definitely check if the sources are okay. Then you can discuss that one.
Right.
Or otherwise, but you can say that we don't trust that particular website or that particular link. What you can suggest is, it's better that you go for second opinion.
Better.
That will give you,
right.
more confidence. And you can, in fact, the doctor can himself suggest the other doctors, or it's better that let the patient decide which doctor they want to go.
That's much better. I guess that's much better, that we give a free will and free empowerment to the patient. And once we are making a diagnosis and actually writing down on the paper. So before, and sometimes we are also like, there are vague diagnoses where it's more of a gut feeling. Medical science is not 1 + 1 2 always. You know much more. Sometimes you just know that, ma'am, I know this patient will make it. All the patient is looking very bad, and sometimes when we walk and we feel that patient to theek hai, but you know that there is something which is just not right.
Exactly.
You can't pinpoint what's wrong, but you know that there is something is amiss. So in such cases, I think a second opinion would be
definitely helps.
Much better, much better. It just empowers, because medicine is such what to do.
In fact, being a doctor, I have taken second opinion for my patients, for my relatives who are patient ones. So I think it's everybody's right, and it's high time that Indian population should be aware of that. If you don't in medical fraternity, it's probably less than 1% where your healthcare profession might get offended, but this is less than 1%. So I don't want to blame the whole community. Most of us,
we would love it, encourage it actually.
Encourage it, definitely.
Right. And it kind of also, ये medical legal negligence, litigations, ये भी थोड़े से कम हो जाते हैं, because patient also feels fine and you are also on the safer zone with the second opinion.
Exactly.
So anything beyond this, if you want to tell our viewers?
This was our motto. So I was working for an association earlier, and we were trying to push the right to second opinion to our patients. This is a community work that we started, and the response was amazing. We did a small survey and we realized 90% of our population coming to this particular hospital was not aware of this. In fact, 90% of the doctors were not aware of it. So I believe this is a right from patient side, and as a doctor we should encourage it, and this will make not just our life peaceful but theirs as well.
Agreed. So finally we aim that we give the best possible treatment and don't miss out on, as much as nobody is God here, but we try to reduce the problems as much as possible. So rather than taking the opinion of Mama, Chacha, Bua, Mausi and everybody on the WhatsApp family group, it's better that we start taking a proper genuine second opinion from a senior doctor or somebody who is in the same fraternity of your choice. Thank you so much, Dr. Amit. It was such a pleasure talking to you. And if you have any links for the second opinion, anything, we will definitely be sharing it.
Absolutely.
Thank you so much.